Start.
Hello,
Hello.
this is Dr. Gabla, the doctor in the medical assessment unit. Is that Mr. Rosaline, 38 year old?
Yes, doctor.
Nice to meet you, ma'am.
Nice to meet you.
Well, we are here today to discuss your condition and what we can do for her. Is that okay with you?
Okay, doctor.
Well, I'll write some notes. It will be confidential. Is that okay with you?
Okay, doctor. I have no problem.
Okay, I understand from the GB letter that you have suffering of difficulty in swallowing. Can you tell me more about it, please?
Yes, doctor. For last few months, I noticed that I get difficulty in swallowing my food. I cannot take food as easily as I could do before. I first thought that it might be some food changes, but that is happening with all kinds of food. I sometimes need to take some liquid food due to this issue. And so I visited my GP. He thought that it might be some gastric upset. So he gave me some omeprazole tablet and said that it will help. But that hasn't helped me a little. Rather, the problem is increasing. So he thought that I might be something abnormal. So he sent me here.
And before this period, did you have any problem with your swallowing at all?
No, doctor.
And does it start suddenly or gradually?
Gradually.
Does it start for all type of food or specific type of food,
All
like
type of
solid,
food, doctor.
all type, including the even liquid? You
Yes,
have
doctor. But I
difficulty in
feel
liquid.
somewhat better with the liquid food. I can take the liquid food more easily. But I have facing problem with that also.
And how is the condition progress over the time? Is it increasing or decreasing?
Yes, it is
Or
increasing, doctor.
increasing now. Do you have any pain with swallowing?
No,
Do you feel the food stuck in any part of your food pipe?
I think that food is tracking in my back of my chest.
Can you mention the area exactly? Is it in the middle, lower down?
Uh, I think it is behind the sternum.
Okay. And do you use anything to relieve the symptom?
No, after a few time, it usually resolves on its own.
Does it resolve in specific position?
No,
Do you have any feeling of acidity in the same time?
no,
Do you have any acidity in your mouth and in your throat?
no,
Any pain in your upper part of your stomach?
no,
Okay, fine. Do you have any cough at all?
no,
Do you feel any bad smell from your mouth?
no,
Any feeling of nausea or throwing up?
no, doctor.
Okay, fine. Mrs. Rosaline, do you have any other problem otherwise than this swelling problem? Do you have any tummy pain?
Not tummy pain, doctor, but I think that I have some problem with my bowel also. Sometimes
Uh,
I feel constipated and sometimes I have diarrhea.
I'm sorry about that. Uh, so with the same duration or like 3 months ago or different?
More or like almost same.
Okay. Do you have any blood with the stool?
No,
Any change in the stool color?
no,
And do you have any feeling of going out but you don't do anything?
no.
Okay. And you said no tummy pain at all.
No tummy pain, doctor.
Okay, Mrs. Rosaline. Do you have otherwise any change in your weight?
No,
Any change in appetite?
no,
Any raised body temperature?
no.
Any tiredness?
I feel that I am getting little tired than before.
And anybody told you that you look pale?
No.
Any lump or bump in any part of the body?
Yes, doctor. I noticed some lumps over my finger region.
Which part of exactly? Is it in
Uh,
your nickel?
Yes, doctor.
And does it go and come, or it is there all the time?
It's there for a long time.
Is it tender?
No,
What color is it?
whitish.
Whitish color. And any is it in both hand or one hand?
Both hands.
Do you have another skin rash uh, any part of your body?
No,
You don't have skin rash when you're exposed to sun?
no.
Okay, fine. Mrs. Rosaline, do you have any problem in your breathing?
I am little bit short of breath, doctor, but I don't think that is bothering me much.
Since when this one?
Maybe for last few months.
And is it mild, moderate, severe? Do you have short of breath
I
when you
think it's not
walk?
so severe.
Do you have any cough at all?
Some cough that is dry. I haven't ever produced any phlegm.
Okay. And do you have any noisy chest?
No,
Any problem in your nose, secretion, or anything?
I cannot understand you. Can you repeat again, please?
Do you have any congestion in your
No,
nose?
no, no, doctor.
Mm, any change in your eye color or anything?
No,
Redness or dryness? No
no,
redness, no dryness.
no,
Dryness in your mouth.
no,
Any sore in your mouth,
no,
in your genital area.
no,
Okay. Do you have any chest pain at all?
no,
Do you have any racing or pacing of your heart?
no,
Do you have any headache at all?
no,
Any fits?
no,
Any weakness in any part of your body?
no, doctor.
Do you have any problem while combing hair
No,
when you stand from sitting to standing position?
no,
Any muscle pain at all?
no, doctor.
Okay, fine. Mrs. Selena, do you have any weather preferences?
No,
Any chicken of your hand?
any?
Chicken of your hand?
No, doctor.
Any sweating at all?
No,
Okay. Can I know if you have any long-standing medical condition?
I haven't
Hello?
visited my doctor for a long time, doctor. But I had some problem in my hands. I had some joint pain. I had some funny color changes of my hands. That was for a long time ago. And for that, my doctor prescribed me some medication. I was taking.
Uh, Is it in both hand or one hand?
Both hands.
And which joint exactly?
Joints of my hands, doctor. Finger joints.
Do you have any stiffness
Yes. In the morning, I have a stiffness for that
for how long?
for a half an hour to 1 hour.
Uh,
Yes.
okay. And any other joint problem in your knee or any part of your body?
No. 10 minutes have
Any
passed.
any neck pain or back pain?
No.
Do you take any medication?
For funicular sense, my GP prescribed nifedipine tablet. I take those.
Hmm. And did you admit to hospital anytime?
No.
Any allergy to any medication?
No.
The over-the-counter medication?
No.
Any family history of no?
No.
Can I examine you, please?
Okay, doctor.
So I will look to general condition if there is pillar or jaundice, if there is nutrition status,
This is a
cachexia.
surrogate. This is not a real patient, but you can proceed with the examination.
Okay, and any pillar, any cachexia,
No.
no jaundice.
No.
Okay, I will check the hand for the knuckle, the joint in the hand, any deformity,
No
any joint
deformity.
issue, any joint issue,
No.
any change in the skin,
What type of sense?
sclerodactyly, thickening of the skin,
Yes.
up to where?
Elbows.
Up to elbow. And otherwise, any skin changes in the face, any small mouth,
Yes.
peaking of the nose,
Yes.
any telangiectasia,
Yes.
any changes in the eye.
No.
I will examine the chest if any crackles, lung fibrosis like this.
Basal crackles present.
Okay, the B2 palpable, not palpable.
Not palpable.
I will look for any lymph node,
Not palpable.
any any evidence of renal phenomena, any necrosis in the finger, any.
No.
I will examine the abdomen, any pain, any organomegaly.
No.
Okay, what do you do for living, Mrs. Selena?
I'm a housewife, doctor.
Mrs. Rosaline, sorry.
I'm a housewife.
Is this affecting your daily living?
This condition isn't, doctor. I had funicular senses so that I couldn't use any water products, especially any cold water. So actually, it is affecting my daily life because I cannot do my homeworks, do my houseworks properly.
So what happen if you use cold water? Any change in your skin?
Yes.
What happen? It change in color from white to red and blue.
Yes, doctor. That's right.
I'm sorry about that. Uh, so I advise you to avoid the cold water. Use gloves, and I will refer you to a group of specialists to give you some advice to avoid this condition. Is that okay with you?
Okay,
And
doctor.
I will refer you as well to occupational therapy and social support.
Okay, doctor.
Uh, do you have any concern for me, Cecilia? Do you
While
smoke at
having
all? Sorry.
yes, doctor. I smoke
How many cigarettes for how long?
about 5 or 6 sticks a day for last 20 years.
Mrs. Selena, smoking very hazardous to your health, especially for your condition. progress your condition. I advise you to stop the smoking totally, and I will, if it's okay with you, I refer you to smoking cessation clinic. Is that okay with you?
Okay, doctor.
And do you drink alcohol?
No.
Okay. What is your concern, Mrs. Rosaline?
Why I am having this, doctor? Is it any cancer?
Uh, Mrs. Rosaline, it is not a cancer. It is a condition called scleroderma, systemic sclerosis. It is a condition in which there is a difference in our immune system. This our immune defense system attack our own body and different type, different part of our body. It caused your symptom of change in your skin in the hand and in the in the face, and it affects the lung also, causing some shortness of breath, and it affects the swallowing as well. I will admit you for now, do an investigation, and I will refer you to group of specialists, including the joint specialist, the lung doctor, and my consultant, and nutritionist, and bowel doctor, and I advise you to stop smoking and to avoid cold weather. And I will refer you to occupational and social service as well. Uh, and I will meet you again for follow up and to discuss the further plan. Is that okay?
Okay, doctor.
Do you have any more concern for me, Mrs.
Is it
Rosaline?
curable, doctor, or do I need any surgery?
I'm sorry, Mrs. Rosaline. It's not curable, but we can control the disease by treating all the symptoms. We'll be under close follow-up. We'll not monitor your symptom and start you with the treatment. It help you a lot with your symptom. And
Time up.
for now, hmm,
Okay. Have you reached your diagnosis?
it is swallowing difficulty and secondary to systemic sclerosis.
Do you have any differential diagnosis?
We should rule out carcinoma of the esophagus.
Yes.
Mixed connective tissue disease could be differential.
Okay. How will you investigate her?
We'll do for her basic investigation, complete blood count, RFT, LFT, electrolyte, inflammatory marker, autoimmune profile, uh, rheumatoid factor, ANA, and other autoimmune profile. We will do for her chest X-ray and high resolution CT, and we'll do for her endoscopy for the esophagus, study for the renal phenomena by dactyloscopy. Uh, uh,
That you mean capillaroscopy?
capillaroscopy, and pH monitoring for esophagus.
Do you think of any echocardiogram for her?
Echo, yes, we need to do echocardiography to rule out pulmonary hypertension.
Okay, that's fine. So how do you manage her?
The patient need admission now, need to avoid cold weather. Uh, for her, need counseling and education, stop smoking, refer to occupational and social service. And we will refer her to group of MDT, multidisciplinary team, including my consultant, GI doctor, pulmonologist, rheumatologist, and cardiologist, and we will follow up her when we need to do gastroscopy and echocardiograph, and we'll start her with analgesia and steroids.
Okay, and can you name any medication for her dysphagia?
We need to give VBI, proton pump inhibitor.
Do you think any prokinetics?
Prokinetic medication like metoclopramide, erythromycin can help. So,
Okay, that is fine. Thank you.
thank you.
Yeah, and for history taking for dysphagia, you was totally fine, but I can understand that you are upset for any reason, so that you are not as productive as before. Yeah, and for dysphagia, there are signs of there are other for dysphagia. There are things of any neurological. I cannot remember if you have ruled out any neurological or muscular causes. Asking any nasal regurgitation, any changes in the voice, and
Yes.
which part of swallowing. Is there any difficulty in chewing?
You mean bulbar palsy like this,
Yes,
speech change? If there is
yes,
any change in
and
her
also,
speech?
is there any difficulty in chewing? Does she feel weakness or tiredness after chewing for a time? That is for myasthenia gravis.
Yes.
Okay, and what phase of eating does she feel difficulty? So that it could rule out that which part is affected. Is it oral cavity, pharynx, or esophagus?
What we can ask here when you start
Okay, when do
taking
you
the
feel
food,
difficult? Yes, yeah. Do you feel difficulty in chewing, or do you feel any weakness after chewing for a while? That means the problem in the oral cavity. That is can be myasthenia gravis or any problem in nerve palsy or any muscle problem in the that is affecting oral cavity. Then any uh, then after chewing, do you feel a difficulty taking the food passing into the food pipe? That is problem in the pharynx that can be due to bulbar palsy. Have you ever noticed any food coming out through your nose? That is bulbar palsy, problem in the pharynx. Or after swallowing, do you think any food is stuck in us, or food is not passing through the food pipe properly? That is esophagus. So we exclude the side by asking these questions. Okay. Then onset, you have asked that character, which type of food, both type of food you asked that. There is no radiation, so it is not and associated symptoms if it is muscular type, neurological type, or mechanical type. And this dysphagia due to the scleroderma, this is mechanical type. That is, there is narrowing of the food pipe, not any myopathic type or not any neuropathic type. So associated symptoms with any signs of any stroke signs, or any weakness, any changes in the voice, any changes in the uh, any changes in the voice, any changes in the any changes in the speech or voice, any weakness, any particular side of the body that could detect it is case of post-stroke condition or neurological condition. Then any timing, It's not associated with signing that which part of the we can exclude it on the site. That's which part, which phase of the swallowing is affected. Then any eliciting factor have it does anything make it worse or better? Then severity, can he take regular food or he cannot take any food? That is will help us to if she needs any admission and IV nutrition or not. This patient can eat, so that I think that this patient does not need admission at this time. Whenever you came to the site, you can almost come to the diagnosis that which part is affected after the site. That for esophagus, there are some, it is associated with pain. Then odynophagia, for odynophagia, there are causes like infection, esophagitis. In the infection, it can be herpes simplex, it can be candida, or any post-corrosive poisoning. Okay, and after that, in the past history, I told you and I tried to give you the clue that some funicular changes in the hands. And whenever comes with a case of dysphagia, it is a common case that comes with systemic sclerosis.
Especially with this age, with women, female with this age, I should
Yes,
be first with the
rheumatological signs that if you went for earlier cases, then it would be very easy for you to detect the case. And after that, in the past history, you have asked it well, that was fine. In the medication history, I cannot remember if you have excluded any allergy to any medication, any over-the-counter medication, any herbal products. And family history, I think you have asked it. Personal history, you have went for that. That was fine. And for the uh, any scleroderma complication, acute complication, I cannot remember if you have asked any problem with my water work. There was one that is acute kidney injury, scleroderma crisis.
Yeah, I don't ask.
If there is any scleroderma crisis, okay. And after that, in management, that was fine. And in the investigation, always I have been learned that when I was telling the investigation, try to find say it in the full form, that LFT, it will be somewhat difficult for the person who is not involved directly with this case, because for neurologist it will be difficult to decode what he mean by LFT. Rather say it liver function test, and if there is any expected finding, try to answer that. That I am going for the chest X-ray for any uh, basal crepitation or for any signs of pneumonia, whatever you expect. Just try to that if it is present or not. And for endoscopy, I am going if there is any signs of narrowing. Okay.
Okay.
Otherwise, everything was fine. So, do you want to add anything?
Uh,
Uh,
it is famous case for station 5, but I don't have enough time to do all the screening. Strange. How during station 5 you can do everything with short time.
we are not going for the station 5, so it is not our what is called, it is not our concern. In the station 5, there is given the cases, but we will be given dummy cases that is told by the RCPI. So seeing the patient reaching to the diagnosis will be difficult. Rather, we have to must focus on the history.
If the examiner asks if it is limited or